Your Excellency, First Lady, Honorable Ministers, Vice Chancellor of the University of Rwanda, Professor Senait Kisaha, Director of International Programs at the Susan Thompson Buffett Foundation, dear partners, distinguished guests, good evening. I want to start by giving you the warmest welcome this evening and expressing our gratitude to all of you for joining us in celebrating this grand milestone. The University of Rwanda will be launching 13 new medical training programs, of which 7 fellowships, 4 residency programs, 1 master's, and 1 PhD. For the fellowship programs, we have adults and pediatric cardiology, gastroenterology and hepatology, nephrology, endocrinology, gynecology, and maternal-foetal medicine. For the residency programs, we have plastic surgery, pediatric surgery, neurology, and dermatology. Finally, there's also a Master's of Science and a PhD program in clinical anatomy. This follows the minimally invasive surgery training program that started last year. This event would not have happened without all the teams that have worked tirelessly to make these programs a reality. Those in the room and those who are not with us tonight, congratulations and thank you for your outstanding contribution. This is a major step towards developing and sustaining tertiary and quaternary services in Rwanda through the care that will be provided to patients, the trainings, and the research activities that will be conducted. This level of care has come at such a crucial time, given the number of Rwandans who travel abroad seeking such services. Despite the existing local demand, the number of qualified professionals, medical specialists on the ground, who are equipped with the right skills to adequately respond to such needs is still low. Hence, the necessity to increase their numbers and capacity through these training programs that we are here to launch today. The Human Resource for Health Secretariat is happy to be working with equally committed colleagues from the University of Rwanda, the Higher Education Council, the teaching hospitals, as well as partners who have been and are still incredibly supportive, like the Susan Thompson Buffett Foundation, the Clinton Health Access Initiative, and several different academic institutions worldwide. We have partners in Africa, in Europe, in Australia, and in America. These colleagues and partners have shown equal eagerness and enthusiasm towards advocating and improving health services through different interventions, and even reaching out to stakeholders in their own networks who have actively helped in the development and the review process of these programs. This kind of momentum has been encouraging and has given us the hope to keep going until we have skilled, high-caliber cadres who will ultimately be able to sustain these programs in the long run. I would like to seize this opportunity to remind that this is only the first step of an ambitious journey. Given the gaps in the quality and the quantity of the health workforce, it is of crucial importance to join forces in doing all the possible outreach to attract the necessary resources so as to create a healthcare system that is fit to meet all the needs in the country. All these training programs will take place in hospitals. The teaching hospitals have therefore an essential role to play in the success and the outcome of these training programs. A successful outcome will require commitment, effective collaboration, cooperation, and coordination with all the key stakeholders. We are counting on all your support for the success of these training programs, and we welcome your ideas geared towards achieving this. This is an unparalleled opportunity to be able to serve the Rwandan community, as well as build the future of advanced medical care in Rwanda and in the region. So we are all fortunate that we have all of you on board. Thank you for your commitment to building a remarkable health system that responds to the people's needs. Thank you.
Your Excellency, the First Lady, Honorable Ministers, Honorable Vice Chancellor, Executive Secretary, HRH, distinguished invitees, dear colleagues here present, good evening. I'm pleased and I'm very happy today to stand here to celebrate this biggest milestone that we really have achieved as a country. This was a very long time dream that started a long time ago. And I do remember like 2.5 years ago, when I started to see a few of our colleagues with a dream. And with that dream, they had very big challenges on how to make them realizable. Today, we are here to celebrate that we have been able to achieve this dream that was a bit difficult at the beginning. So, I will just give a very brief overview and a short presentation on how we developed this program. We developed these programs just in reference to the country's vision and strategies. We refer to the NST1 and the Vision 2050, which emphasize the sustainable knowledge-based and service-led economy, the development and operationalization of a thriving skill ecosystem, highly skilled workforce development, and others. And to the mission of the University of Rwanda, which is to support the development of Rwanda by discovering and advancing knowledge and commitment to the highest standards of academic excellence, where students are prepared for lives of service, leadership, and solutions. Referring to all of these two important documents, we developed our goal to develop a critical mass of specialized medical workforce needed for the achievement of these medium and long-term visions of the country that I highlighted before. Our very specific objective with this enterprise was to train highly specialized doctors to decrease the gap in medical workforce in the Rwandan health sector. The second was to develop competent faculty for the training of residents and medical students. And the third one was to contribute to the development of the state-of-art specialized services that can attract medical tourism to Rwanda and position the country as a health hub in the region. We saw so many opportunities in this country to help us achieve this ambition. First of all, and we really express our gratitude to the government of Rwanda for the establishment of the HRHS Secretariat to support education and training of health professionals. We saw a large number of academic partnerships in the domain of medical education that were ready to assist us and to facilitate this transition. The third one was the establishment of the IRCAD, Africa in Rwanda. We also saw the development of a CAT lab at King Faisal Hospital. But also, I can cite the establishment of a radiation oncology center at the Rwanda Military Hospital, so many dialysis units in Kigali and other cities of the country, and so many other opportunities on which we saw as potentially capable to help us to achieve our ambition to train more specialized health workforce. We started this ambition by designing some programs based on the experience we have for running 13 already existing medical residencies, and on that we added 4 additional medical residence training programs, including dermatology, which is a specialty to treat the diseases of the skin, plastic surgery, neurology, and pediatric surgery. I will also highlight that for the program of pediatric surgery, it will include both an MMed, which is a residency program, and a fellowship training, which is a subspecialty training. We also designed 7 subspecialty fellowship programs, as the Executive Secretary of HRH has highlighted. They include both adult and pediatric cardiology, nephrology, gastroenterology, endocrinology, maternal-fetal medicine, and gynecologic oncology. All of these are coming to answer the issues and the problems we have and we see rising in the health sector, including non-communicable diseases, include cancer, diabetes, hypertension, and other cardiovascular diseases that are coming as important issues in the country. This is just only the first phase of what we have developed, but we are continuing to develop some other programs. So far, these ones have been approved. I had forgotten to mention that beside those very clinical training programs, we have also to train anatomists. Those who are clinicians but also interested in anatomy, but we have also 2 programs, including a Master of Science and a PhD program in clinical anatomy. All of these were approved and are ready to start this month. The second phase that we are working on includes other 9 programs that we are discussing, some of which have already started being drafted. Those include clinical pathology. Because all of these programs that we are developing will rely on efficient and effective laboratory and other supporting diagnostic facilities. So we are training clinical pathologists to support all these other programs that we have developed. We are also working on the other diagnostic programs, including pediatric radiology and interventional radiology. Further to that, we have also started designing a program for ophthalmology and others that are being discussed, including the transplant surgery, trauma and acute care surgery, cardiothoracic surgery, vascular surgery, and neonatology that is already at an advanced stage of development. Looking at the program's outline, majority of these programs, especially the fellowship programs, will last for 2 years, except for 2 programs that are cardiology that will be, for which the length will be 3 years. With the available capacity at the moment, we are only able to enroll 2 candidates in each of the programs, but I will remind, considering the number of programs we have designed, we will be having a good number of subspecialties at the end of each of these trainings. However, we have also other ranked long programs, including those residency programs, such as dermatology, which will be 4 years, plastic surgery, that will be 5 years, pediatric surgery will be 5 years, but we will also have a 3 years program fellowship for pediatrics, and we will have a 5 years training for neurology, which is a specialty for treating and managing the neurological problems. For the programs in clinical anatomy, it will be either a 2 years full-time or a 3 years part-time Master of Science in Clinical Anatomy and a 3 years full-time PhD in Clinical Anatomy. We have modeled the competences expected from this program on 4 important frameworks for writing the competencies. The first one we modeled against was the University of Rwanda's graduate attributes that has defined the 10 graduate attributes that we follow for all of the programs that are existing at the University of Rwanda. The second framework that we modeled against was the Rwanda Standard for Postgraduate Medical Education of the Rwanda Medical and Dental Council, but also we benchmarked against international standards, including the Accreditation Council for Graduate Medical Education that is American, but also against the CANMED, which is a Canadian qualification framework that defines also the 5-star doctor established by the WHO. So all of these have helped us to make sure that our programs are designed with necessary quality and that they reflect international standards. How will we organize the curriculum and the learning experience? Each of the curriculum involves so many layers of trainings, including, but not limited to, didactics. Those include lectures, modules that are necessary for achieving the learning outcomes that are expected, and knowledge content that are prescribed for each of the programs. This will be combined with the clinical rotations of sufficient length to ensure an adequate learning exposure. The third one is about inpatient and outpatient attachment of fellows or residents for sufficient also duration and exposure. We will also use bedside teaching, case discussions, and use of the current evidence in diagnostic and therapeutic decisions. The supervision of fellow will be mandatory in the performance and interpretation of procedures until proficiency have been acquired. Fellows will function as part of an effective interprofessional team, and because we know that we do not have everything in country, we have also provided a space for fellows to be placed in high volume centers abroad, not in Rwanda, because we want them to be sufficiently exposed even when we do not have all available on ground. Last but not least is about scholarly activities, because medicine is both an art and a science. We want fellows to be able to think more critically than they can do at the moment, to be able to evaluate the literature, assimilate new knowledge, and practice lifelong learning. Each program will be required to create an environment that fosters the acquisition of such skills through fellow participation in those activities, such as the discovery, integration, application, including teaching. We expect fellows to participate in teaching of residents, but also medical students. And the scholarly activities that are planned into those curriculum will reflect the variety of the physician's role, including being a clinician, being a scientist, but also being educators. So we plan that we will make sure we have a strong assessment program that helps us to ensure that fellows have developed the required competencies and that they can demonstrate those competencies. So we will rely on frequently feedback on the fellow's performance to reinforce well-performed duties and tasks, as well as to correct deficiencies. Formal assessment will be required at completion of each rotation or block and will be documented and discussed with fellows. The assessment of procedural competences will include a formal evaluation process in addition to the minimum number of procedures that will be performed, and this is reflected into each curriculum. We also will rely on the use of multiple evaluators, including the faculty members, peers, patients, self-evaluation, and other professional staff members to ensure that the learning outcomes will have been achieved. In addition to this, we will also comply with all the other assessment requirements prescribed by the University of Rwanda into its frameworks. So the needs for these programs, however, are still immense. Some of them have been achieved, others are yet to be achieved. So the majority of the programs will still rely on expatriate faculty to start. At least one expatriate faculty who is a full-time for each of the new programs, majority is available in country to support the start of the program, but additional full-time equivalent faculty will be available through academic partnerships that have already been established. With these programs, we know that the sustainability will come from graduating more and more, because they are short. At the end of 2 years, we will have achieved at least 2 additional faculty able to train the other generation of young specialists to also continue on and on. This enrollment, as I said, will be limited at the beginning at 2 candidates for the fellowships and 3 to 4 candidates for residence. This is in line with the available capacity at the moment. But as we go through, we will be developing capacity to enroll more and to extend the enrollment to foreign candidates to make sure that medicine also is, medical education is attracting medical tourism as well in country. Majority of resources that are necessary are available at teaching hospitals. However, there are still things that are not yet available, but that we are working towards in partnership with all stakeholders, especially the Ministry of Health through the HRHS program, Secretariat, and with our affiliate teaching hospitals. These programs will need advanced equipment, advanced consumables, to make sure that they are useful and efficient in the management of the Rwandan population. So all of this will require an investment at the beginning, but we believe that they will self-sustain in the near future when our programs and facilities will mature in the very near future. Our expected outcomes, which is not really in the long run, once established, the new programs, associated services, and facilities will provide specialized services to the Rwandan population, will generate incomes for self-sustainment, will attract medical tourism to the country, and will contribute to the growth of the service-led economy as articulated by Rwanda's National Strategy for Transformation 1 and by the Vision 2050. So to conclude, I want to extend our warmest and deepest gratitude to everybody who have contributed to this. I want to acknowledge the support we received from the higher authorities of the University of Rwanda, which supported us throughout the design, approval, and now into implementation of these programs. To the Ministry of Health, and especially this Human Resources for Health Secretariat, because they have been with us at each and every step in the design and development of this program. I want also to acknowledge the experts here present, my fellow colleagues, who have worked tirelessly, day and night, after heavy working hours, to design these documents, each of which is like almost 150 pages. So this was a heavy work, which was done without stopping other academic activities. We really appreciate their dedication, their hard work, and commitment to the development and design of these programs. Both of them local experts, but also expatriates who have helped us. Really thank you so much. I want also to acknowledge other partners who have helped us to achieve this milestone, and those include other stakeholders, including the Higher Education Council and Rwanda Medical and Dental Council. I know how they also worked very, very hard to have this approved. Sometimes if you give those big documents to people, actually it becomes not easy to read, to give comments, give constructive feedback on which to build to develop these programs. So this is really a special day for us. This is a special day for the country, and it's an important milestone. We believe that this will change tremendously the care provided to the Rwandan population and will immensely influence the health sector's performance. Thank you very much, Your Excellency, First Lady. Thank you very much, Honorable Ministers. Thank you very much, VC, Executive Secretary HRH, and all of you distinguished guests. Have a very good evening. Thank you.
Your Excellency, First Lady, Honorable Minister, Professor Senate Fisiha, Director of International Programs at the Susan Thompson Parfait Foundation, Vice Chancellor of the University of Rwanda, distinguished guests, good evening. It is a pleasure and honor to be part of this launch of 13 new medical training programs, which will contribute to the development of our health workforce, therefore improving the quality and quantity of care provided to our citizens. Our Vision 2050, under the Human Development Pillar, prioritizes universal access to high-quality health care, universal access to high-quality education, and a transformed workforce for higher productivity. The Ministry of Education stands ready to work in synergy with the Ministry of Health, HRH Secretariat, and all relevant institutions to reach that vision. The implementation of the new training programs will continue to strengthen the health system, focusing on treatment and advanced care as much as we, as a country, continue to promote a healthy lifestyle and prevent diseases. Success in improving the health and well-being of our population will be evidenced by continuous increase in years of healthy life. The selection of priority programs is based on data and will help to address diagnostic and advanced management of cancers, kidney, and heart diseases, which are among the top 3 reasons for transfers abroad through the Medical Referral Board. The Ministry of Health has our full support towards achieving an effective, high-performing health system able to provide the most advanced care. And to this point, I want to comment on the question that was raised by Professor Senate and responded by the Minister of Health. The numbers of doctors to be trained is not static. We look at it again and train the number that is feasible and that will respond to our needs as a country. I want to take this time and personally commend all of you who contributed to the development of these programs that we are here to launch. I understand that it has been a tedious exercise that involved various institutions here represented, as well as other partners in different parts of the globe. I want to thank the Susan Thompson Buffett Foundation, partner universities from around the world that will contribute to the training in all the programs. Your Excellency, First Lady, Honorable Ministers, distinguished guests, as I conclude these remarks, I remain convinced that doctors who will train and those who will be trained through these programs will make a positive impact in the lives of the people they will touch, the patients, the students who will learn from them, and the teams they will work with. I thank you all for your kind attention.
Your Excellency, First Lady, Honorable Minister, Professor Senite, distinguished guests, good evening. Your Excellency, First Lady, we are honored that you have accepted to be with us in this event as we launch 13 new medical training programs despite your busy schedule. To be able to respond to the need of specialized and subspecialized health services, the Ministry of Health participated with other key stakeholders in development of the National Strategy for Health Professions. I take this opportunity to thank all who participated. The strategy has set targets to train the next generation of health professions, educators, and more than 6,000 health cadres over the next decade. Its implementation requires a significant amount of resources, mostly in terms of attracting highly qualified faculty members, constructing appropriate infrastructure, and procuring the needed equipment. The government of Rwanda is committed to allocate required resources in close collaboration with our strategic partners involved in health workforce development. This will allow us to increase, starting at year 2, number of enrolled candidates each year by subspecialty. The Ministry of Health will ensure effective collaboration between all teaching hospitals and School of Medicine operating in Rwanda. In addition, the implementation of these training programs goes hand in hand with improved patient access to our university teaching hospitals. The issue of access to King Faisal Hospital, already identified as a teaching site for most of the programs, has been among our key assignments in the last few months with RCSB. Today, we can rejoice for the establishment of a framework of collaboration between CHUs, teaching hospitals, Rwanda Military Hospital, and King Faisal Hospital that will allow the transfer of patients from teaching hospitals to King Faisal Hospital, depending the readiness to treat them in a very short period, while teaching fellows enrolled in these programs. Our aim is to avoid having long waiting lists in CHUs. We also worked with RCSB on the review of the referral system to allow patients under community-based health insurance to access King Faisal Hospital for emergency or elective conditions that can only be performed at King Faisal Hospital. On that note, I wish to commend effort and dedication from leadership and technical teams from RCSB, MOH, and staff from above-mentioned hospitals who helped to reach the revised framework. Your Excellency, First Lady, we are extremely grateful to you for the resource mobilization that you have been undertaking to support the development of the health sector in general and for the National Strategy for Health Profession Development in particular. A good example is the support from Susan Thompson Buffett Foundation through Imbuto Foundation to build the maternity at Kabgayi Hospital that will be soon completed and will serve as a teaching hospital for doctors, nurses, and midwives. We sincerely appreciate substantial financial and technical support given by Susan Thompson Buffett Foundation to King Faisal Hospital and to the rest of health system. At this moment, Your Excellency, I would like to invite Professor Senait, representing the foundation at this function, to give her keynotes. Professor Senait, I'm honored to work with you. Thank you.
Excellency, Janet Kagame, the First Lady of the Republic of Rwanda, Excellency, Ministers, Excellencies, colleagues from the Human Resources for Health, HRHS Secretariat at the Ministry of Health, Excellency, the Vice Chancellor of the University of Rwanda, Dean Birengero, the Dean of the University of Rwanda, heads of teaching hospitals, faculty, fellows, staff, and fellow Rwandans and partners and colleagues in the room. It is an enormous honor for me to be here. It's a tremendous privilege to be part of this monumental occasion. And most of all, it gives me enormous joy to be invited to speak on a topic that is very personal to me, not just professional. As in several other countries we support, I have witnessed the paucity of specialty doctors and the low ratio of physicians to population that has left most Rwandans without access to specialized care. As a result, an increasing number of the population continue to seek specialty care in countries such as Thailand, Turkey, and India. And I can't help but ask myself why we cannot reverse this trend and become the beneficiaries of such medical travel ourselves. The lack of subspecialty training is an important push factor that significantly contributes also to the brain drain. Well-educated and expensively trained doctors migrate to wealthy countries, and sometimes not so wealthy countries that can pay them more, sometimes in search of better pay, other times in pursuit of higher education and simply an opportunity for professional development. The majority of these doctors who acquire specialized or postgraduate training abroad also do not return home after completing their studies. So this suggests that if we provide subspecialty training opportunities and opportunities for career advancement and employment in subspecialty care, the migratory flow can be reduced and we can actually retain our doctors. So thus, in addition to being cost effective to train subspecialists locally, fellowship programs can be a means to retain our bright and talented physician workforce. Over a decade of experience working with St. Paul Hospital, Millennium Medical College, has shown me that a highly effective model for physician retention and excellence in quality healthcare is possible through postgraduate training programs. In a short period of about a decade, myself, along many of my colleagues, some of them are in this room, we were able to transform an institution that had no residency training program to a leading national health institution that now offers over 27 subspecialty care, including renal transplant, hepatobiliary surgery, and very high quality, affordable public sector in vitro fertilization. St. Paul has since shown massive improvement in quality of patient care, improved provider retention, and desire to continue practicing in country even when other opportunities are available. The expansion of specialty and subspecialty care has also made affordable quality health care available locally, preventing foreign currency flow and wastage while patients access the care they deserve at home. Medical travel from sub-Saharan Africa are the largest contributors of the medical travel industry, both in terms of numbers and revenue. Many of us may have seen reports that indicate up to 100,000 East Africans travel to India alone annually due to perceived low quality care at home or absence or high cost of care in their home countries. Sadly, scores of these travelers face incidents of harassment and violent attacks while seeking care in India. Unavailability of specialty care such as bypass surgery, cancer treatment, and transplant are often the major drivers of medical travel, with oncology and nephrology care being two most popular services and procedures that patients seek treatment abroad. Further, we often, I being one of them, criticize the tendency of leaders and elected officials in Africa to seek medical care in rich countries instead of developing and building the needed human resources and infrastructure at home. Outbound medical tourism costs us millions of dollars in foreign currency, while we could have benefited from it: increased GDP, improved healthcare infrastructure, attracting foreign currency, and promoting tourism, and most importantly, developing and retaining skilled medical professionals. Some reports estimate that the global medical tourism market can reach up to 100 billion per year, with East African specialty care market reaching up to about 150 million annually and continues to grow. So we must bring these treatments and services close to home for fellow Rwandans, neighboring population around us, and citizens of the continent, so there would be no reason for them to travel long distance into a foreign continent. I have deep conviction that health workforce development is central to our response to such persistent challenges. And this sad reality further validates the specialist training and advanced knowledge and expertise in subspecialty services are vitally important in building a sustainable healthcare system. We are also seeing an unprecedented challenge in lifestyle and behavior that contributes to increase in cancer cases, cardiovascular cases, and diabetes, which has further led to increased demand and significant unmet need for specialist care. Specifically in Rwanda, robust specialist and subspecialty training have become indispensable in the growth of an equitable and sustainable health system. And if we continue to reinforce specialty and subspecialty skills, we can unleash the potential of the medical tourism industry and further attract global centers and partnerships. In this regard, I do believe the pandemic has taught us the enormous value of developing local solutions, local workforce, and service delivery capacity. And as we emerge from this pandemic and start to reflect, healthcare hopefully will remain top of mind for us, and there is now an opportunity for Rwanda to be potentially a leading medical tourism destination. Rwanda, a country that I call home, has an enjoyable climate, a track record of grand ambitions and execution, safety and security, and a multilingual population that speaks Kiswahili, French, and English in addition to Kenya and Rwanda, which makes us very ideal medical tourist destination in the region. Our vision, as Dr. Valentine talked about, our Vision 2050, under the Human Development pillar, prioritizes universal access to high-quality healthcare, universal access to high-quality education, and transformative workforce for higher productivity. To achieve this, we need to continue to explore and implement best policies and practices in health workforce development, including subspecialty training. These are inextricably linked initiatives, And for Rwanda to become a destination for medical tourism, we also must increase financing for training institutions, workforce development, and tertiary healthcare. This also requires substantial public investment, as it is a long-term and resource-intensive effort. Experienced specialist doctors and trained fellows are key to achieving this objective. Rwanda is indeed very well positioned to harness this goal. And to further realize this, we must also have policies that encourage domestic and external investments in workforce development, the necessary training facilities, infrastructure, the right medical specialists, and particularly in those areas where patients seek treatment abroad. I would like to take a moment to give a shout out for everyone in the room for your enormous commitment over the last 2 years in putting together the work that was needed to achieve and get us to today. But I particularly want to thank the First Lady, who about 2 years ago, through our Imbuto partnership and met and brought the idea of subspecialty training. So in Rwanda, I'm always amazed how the highest leaders who in many parts of this continent are not found to be invested in health are the very drivers of the healthcare revolution that is allowing our doctors and nurses and frontline healthcare providers to give the kind of care they so desire. I also want to give a shout out for the local champions, of course, because we have very limited subspecialists in many of these areas. We have recruited many expats, and I'm very grateful for all of you who believed in our vision and came to join us. But I really want to acknowledge the very few subspecialists in country who have been carrying the burden of service and now have willingly, in addition to all the work that is sitting, waiting for them, have stepped in to be local champions. Grateful to all of you, grateful to the many partners, development partners, universities across the globe, Ministry of Health, Ministry of Education, HRH, HEC, University of Rwanda, all the teaching hospitals, and by the way, congratulations to King Faisal for being added as part of the 4th teaching hospital in addition to Siashuka, Siashube, and Kanombe Teaching Hospital. I do believe I will continue to push all of us to think about increasing the number of trainees, while, as dear Birengiro acknowledged, certain subspecialties may not allow, like renal transplant, where we may not have the caseload. Specialties like GI, where we have massive volume, or nephrology, where we have a huge burden of renal disease. I think we need to push ourselves to explore what is possible. And I think I can't think of a better country than Rwanda to push their limits. Rwanda has continued to be recognized for its success and progress towards offering universal access to primary health care. The National Strategy for Health Professional Development that is led and implemented by the HRHS Secretariat is potentially a very transformative strategy that will significantly improve the quality and quantity of health workforce through a well-thought-out specialty and fellowship training program. Through implementation, we're making significant stride in revamping the health sector, and I truly believe that we can develop world-class specialty healthcare services that will position us as a regional medical tourism destination. Of course, while specialty services pose numerous health and economic benefits, we need to continue to be mindful of the potential challenges such efforts may pose to local health systems. Our objective is not to prioritize the needs of international patients, and especially care over those of locals or basic services. We will need to be intentional not to worsen inequity and unfairly shift resources towards the development of more expensive clinical interventions. So this is an area that is going to require us to remain intentional and thoughtful. I want to reiterate that I am absolutely deeply committed to supporting this important national priority and hope to further deepen our partnership with the Secretariat, with the teaching universities, of course with Imbuto, with the Ministry of Health and any other stakeholder that will play a key role in not only training the subspecialty doctors, but also that ensures the quality and competency of these institutions. I do know for sure, if we work together and coordinate our efforts, we can create the future we want for Rwanda and Rwandans, a future where we put our trust and resources in the hands of our own health professionals and healthcare providers, and a future where our people can access the best healthcare they need, when they need it, and where they need it. I do look forward to our continuing collaboration.